Stop settling for temporary fixes and disappointment.
My name is Emin Gül. I am working in Vera Clinic as a doctor that are responsible for the hair transplantations.
Discover why DHI and Sapphire techniques mean less bleeding, quicker healing, and denser, natural results. For over 10 years, we've provided the care, the follow-up, and the trust you need. You are in good hands.
Ben Doktor Emin Gül, Vera Clinic Polikliniğinde medikal estetik saç ekimi uzmanı olarak çalışmaktayım. Yaklaşık 19 senedir doktorluk yapıyorum. Saç ekimi işinde de yaklaşık bir 10 senedir faaliyet göstermek.
My name is Emin Gül and I am working in Vera Clinic as doctor that are responsible for the hair transplantations. We are working around 10 years. I am doctor of 19 years. He has graduated for Istanbul University Cerrahpaşa. DHI method, as we are using some special pens that are also in different sizes, and we are putting the grafts into the skin layer, and we are pressing the pens and we are implanting the grafts in. So in the other method, like for the Sapphire method, for example, we are just cutting, like opening the small channels, the small holes, and then we are implanting them. So in this case, you have too many cuts, which is not stay for longer, but still it's open. It will take a little bit more time to heal, and it can be also much more blooding compared to the DHI one. In the DHI one, we are like implanting and opening at the same times. You don't have that much bleeding. You cannot see the hole. It's much more like quicker for the healing process. In the DHI method, there is also the advantage that for the female patient that don't want to shave their hair, we can do it without shaving, as we are doing at once with the DHI method, with the pen method, and so in this way you can do it without the shaving. And of course, in this fire method, there's also the thing that the advantage in this way, we can do it the graft number in much more higher. So let's say maybe like more than like 4,000 grafts. We have to do it once each time. The number can be like reduced to 3,300 to 3,500, for example. So there's just the graph like differences for this. So the most like major points is one is the density of them, and the second one is the naturality of them. So it's very important that your frontal line is look natural as much as possible. So generally in some clinics they are not doing like very natural or suitable according to their face. They can be making the line much more lower or much more higher, or it's unequal, it's not in the same level, it's not as they want it. The density of them should be like really satisfying. Following the patients from the other clinics, they don't see the same. We can be in touch in like let's say 1 year, 2 years or more for them. So this is very important to give them this trust, because if they have any issues when they are coming here, when they are like into the clinic or out of the clinic, or like later also, we are still being here to like take care of them. We have a lot of patients that comes here. They can be like some sickness or also other problems. The delay of the flight can be also happen. But we are doing like taking the appointment and arranging also the transfer and everything according to this. So like of course there are like the possibilities, everything can like happen. And so, but we are arranging according to this, so it will be not like too hard to do it. And also the deposit, we are just asking for a small amount, so it will be also not like any issues. When there is any problems, when he is coming here, we check it and we see that the operation cannot be done because of the health like issues. If we see that there is like any kind of problems, his or her health are much more important for us, and we are giving of course the account that like and the cost that he spent here back him. Of course, we can say that most of the people that are coming here as our patients, they are most of seeing that the result that came out is very in a positive way. So we can say that yes, let's say it's totally normal that like 10% or like a minimal like 5% of the patient has like unsatisfied result, or they can have some major like loss of the hair. But for the other like remaining parts, yeah, the most of the patients are generally, we are doing a good job. Let's say that after like 6 months, 7 months, they are starting to see the results. So 60 or 70% of the place that they are implanted, they have scenes. So we can see, but of course it's still like growing for the 30 or like 40% of them. so they can see like, let's say, through the year. Just the major part is the 6 or 7 months. Gorbe implanted hair that we added. We also like perform during the operation the PRP that will be helping for the nutrition of the grafts and also for the bleeding of the regions, because they have to take them to actually grow. So it's why we are like making this during the operations. But of course, as we like have done also here, after the operation, there are also the laser treatment or the Oxycure treatment that will be helping for their like growing and also the nutrition that they can get or the oxygen that they can get to grow much more better. This is also something that will increase the success rate of the grafts that will be added. We have also risk victims, to prevent them for the infection issues. For example, we give them an antibiotic before. We do it in a sterilized way. The operation rooms and everything that we are using should be very sterile. And this is also important during the whole procedures. We are checking also over to prevent the infection possibilities. And we have also some patients that have necrosis, for example. And this type of patients is why we are doing PRP during the operation and also the laser or the Oxycure treatment. Actually, whenever they feel comfortable and they have decided to do it, this is the best time. If they do it, their arrangement with their work and everything, then they can just start to search, let's say, and they prefer to do it their vacation during the summertime generally. So sometimes we have more patients in the winter seasons. But yeah, the positions feeling that's comfortable is much more something that we want. If the donor regions is really suitable, because the number of them is actually depending on them. We can take only from this part to do it. If they have no issues with their health, problems, their blood pressure is in let's say normal level, not too high. If they don't have this type of issues, of course, they can have done the hair transplantation. The washing process, we actually show them here as they come back for the second day. We are telling that they have part of the healing process take 10 days. They have to wash every single day. And here we are mentioning also about the product that they will be using and show them how they will be applying. In 1 year, let's say there is 5,000 hair patients that we have here. In 50,000 patients. For one session, 5,000 to 5,500 will be the maximum. So we have done 6,000 or 7,000 of grafts in one sessions, but it depends on the patient's donor regions, because when we are taking and fixing on some part, we cannot broke or damage another part. So it's as it's a very important procedure. It's why even we reach 6,000, 7,000 of graft for one patient, is we have to, of course, see the patient and check over it if it's possible to do it or not. Or we also devise in 2 days, for example. Even he is doing in one sessions, we do some part in the first day and then the second part in the second day. As we take much more graft, it doesn't mean that you have much more success, because the donor region also have a capacity, and if we reach that, it can cause the reverse. You have also the blood circulations in the donor region. We have also to protect that. So we cannot think only in one way. So it's depending also about his health situations, also his ages, also the grafts that he spent, their hair follicles, how is it, and also for example in their skin, also other circumstances we think as a whole. So this is also something that should be considering and doing according to this. It means a lot of experience from the back.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.